So I receive a lot of messages if I could make video on antidotes. So in this video I will try to share a trick with you where you will learn about antidotes. So during your exam, during your Nclex exam, you will be able to solve most of your antidotes problem immediately. So the trick to learn is simple steps. So the trick to learn is you just need to know these words. How, I, A, B, B, C, and words come after C? D, right? And words come after D? It's M. So that's the mnemonic you need to know for your antidotes. How, I, A, B, B, C, and then D, M. So H for, let's start with how, HOW, right? So H for heparin, right? So they will give you question, what is the antidote for heparin? Like that way. They will give you long question, but at the end, you just have to find out your antidote. So HOW, right? So H means heparin. So heparin, what is a heparin antidote? Heparin antidote is protamine sulfate. The easy way to remember is HP. You guys know about HP computers and HP laptop, right? So just remember that way, HP, right? So heparin antidote is protamine sulfate. Now go to O. O for opioids. Opioids like morphine, those kind of things. Morphine, hydrocodone or oxycodone or fentanyl, those are your opioids. So what is the opioids? Opioids known as a narcotic, right? Narcotic. So what is the opioid antidote is? Narcotic refer to naloxone. So that's the antidote for opioids. Opioid same as narcotic, right? So narcotic equal to naloxone. Next, moving on. HOW, W for warfarin, right? So warfarin same as comodine. C, right? Comodine. So what is the antidote for comodine? Just remember CK. Calvin Klein clothes, right? You guys wear Calvin Klein clothes, right? So comodine antidote is CK, K for vitamin K, right? Warfarin known as comodine, and comodine antidote is CK. Just remember that way. Calvin cloth. So comodine, vitamin K is your antidote. That's your HOW. Now go jump to next I. I for iron. Some of the antidote you have to just know by your heart. So there is no trick for iron. So you just know iron antidote is defroxamine. Defroxamine. Iron antidote is defroxamine. Now moving on HOW, how I, now going to A. A for acetaminophen, known as Tylenol, right? Acetaminophen antidote is acetylcysteine. Acetylcysteine. So as you can see, both acetaminophen and the acetylcysteine start with ACET. That's the trick that you will remember. ACET, and antidote also start with ACET. That's the way you will learn it. Now next is beta blocker. So any medication names end with LOL, that is your beta blocker. So like metoprolol or propranolol or carvedilol, all your beta blocker. So what is the antidote for beta blocker? It's glucagon. As I mentioned, some of the medication you need to know by your heart, so there is no trick. So beta blocker antidote is glucagon. So next is benzodiazepine. So mostly your benzodiazepine name end with PAM, like clonazepam, lorazepam, or Xanax. Those your benzodiazepine. And in the antidote is uh, flumazenil. Flumazenil. The trick to know is benzodiazepine and flumazenil both has AZE, as you can see, AZE, AZE. So that way you will remember that, right? Next is carbon monoxide. So carbon monoxide, the antidote is 100% oxygen. 100% oxygen. Now moving on to D. D for digoxin. The digoxin antidote is digiband. The trick to know is both start with dig, digiband fab. So that way you will learn digoxin, dig and dg band, dig, right? Next is M4, magnesium sulfate. Magnesium sulfate antidote is calcium gluconate. So both has at the end of magnesium IUM, right? And calcium also has IUM. So that way you will remember magnesium sulfate, calcium gluconate. So that's the wrap of our antidotes. So during your Nclex exam or your nursing school exam or your TEAS exam, you will see this kind of question. And now we're gonna do practice question and answer around 8 to 12, and you will see how easy it is for you to solve most of your problem immediately. So I'm gonna move on, but you have to just pause the video if you want to answer. Pause the video and answer yourself, and then move on to next question. But I will not stop it. I will keep giving you answer immediately, right? So let's start practice questions. And I hope you will be able to solve all your problems immediately. All the questions. So let's question number 1. Let's do question number 1. What is the antidote for heparin? What is the antidote for heparin? So as I mentioned, you just have to remember HP, right? HP computers and HP laptop. So what is the antidote for heparin? HP. Where is P? P for protamine sulfate. That's your first answer, right? Easy. Move on to next question. Same question. Which is the antidote for heparin overdose? So heparin, what is the antidote for heparin? HP. You have to remember P, right? Protamine sulfate. Moving on, next question. A post-op patient receiving IV hydromorphone become difficult to rouse and is breathing 8 breaths per minute, right? The nurse notify the provider which medication should always be available alongside opioid therapy. So this is opioid medication, right? What opioid known as narcotic. So what is a narcotic antidote? Narcotic same as naloxone. Where is the naloxone here? Option A. That is your immediate answer. Any narcotic like hydrocodone, oxycodone, those are your fentanyl, those are your opioids, narcotics. When you're working in the healthcare setting, you count your narcotics, right? In the lock box, right? So that's called opioids. Move on. A client overdose on opioids. Again, opioid question. Which medication should the nurse prepare to administer as an antidote? Opioid antidote is, narcotic antidote is NAR, NAR. Look, where is naloxone? That's your antidote. So narcotic naloxone. That way you will remember. A client receiving warfarin develop bleeding. What is the antidote? Warfarin, another name is Comodine. What did I tell you? Comodine CK. Calvin Klein, right? CK. Where is vitamin K? That's your answer, vitamin K. Next question. A client receiving IV heparin develop bleeding gums and hematuria. Which medication should the nurse anticipate administering? This is heparin question, right? HP. Where is HP? P for protamine sulfate. See, easy. Option B. A patient with iron toxicity is receiving emergency treatment. What is the antidote? So iron, there is no trick. You just have to remember iron is defroxamine. That is your immediate answer, defroxamine. A nurse is administering an overdose of acetaminophen to a patient. Which of the following is the antidote? So acetaminophen and what is the antidote? Both start with ACET. So your option A is your final answer. Acetylcholine. That is your final answer. A client is admitted with severe bradycardia and hypotension after an overdose of metoprolol. Which medication should the nurse anticipate administering as the reversal agent? So metoprolol is same as a beta blocker, right? All your beta blocker names end with LOL, like metoprolol, propranolol, carvedilol. So all your beta blocker antidote is glucagon. Where is that glucagon? Option C is your final answer. Some of them medicine you need to know by your heart, like iron has no trick, iron defroxamine, beta blocker glucagon, like that. So this one also you need to know. What drug is used an antidote for beta blocker overdose? What is beta blocker overdose? Glucagon. Where is glucagon? Option B. The antidote for benzodiazepine overdose is benzodiazepine, all your like lorazepam, clonazepam, clonopine, and those are your Xanax, those are your Benzodiazepine. So what is a benzodiazepine? As I mentioned, benzodiazepine, it has AZE, right? So where is the AZE? Option C has AZE. Flumazenil. That is your antidote for benzodiazepine. AZE. See, AZE in benzo and AZE in flumazenil. That's the trick to learn. The antidote for benzodiazepine overdose is option B. Flumazenil. What would the nurse expect to administer patient who present to the emergency department with toxic acetaminophen level? Acetaminophen start ACET and where's the antidote? ACET, right? So option A, acetylcysteine is your final answer. A patient receiving benzodiazepine suddenly develop respiratory depression. What is the antidote? AZE. Where is AZE? So option B, flumazine. That is your final answer. A client is admitted to the emergency department with a headache, right? Weakness and slight confusion. The physician diagnosed carbon monoxide. Carbon monoxide antidote is 100% oxygen. Option C is your final answer, right? What of the following is the antidote for digoxin? So digoxin and digiband both start with dig. So option C is your final answer. A client receiving IV magnesium sulfate become lethargic and has absent of deep tendon reflex. Which medication should the nurse prepare to administer? So magnesium at the end IUM. You see IUM, right? So magnesium antidote is calcium. CalCium. Calcium both has IUM, right? IUM. So you have even the potassium has IUM, but magnesium calcium gluconate is your final answer. So that's the wrap of our all practice question and answer. So I hope you will learn, now on you will be able to crack all of your answer when you see antidote of any that I mentioned. So that is a trick, and thank you for sending me message, because per your request I was able to find it easy trick to crack all of your answer, right? Good luck.